Well, my name is Clark Fincher. I'm a physician and have practiced general internal medicine in Searcy, Arkansas for the past 33 years. I'm a member of the Arkansas Board of Health and currently serve as its president. Improving the health of my patients and of all the citizens of our state has been a strong interest of mine my entire career. When the Supreme Court of the United States' decision to make Medicaid expansion optional in each state was handed down, I took a careful look at the pros and cons of expansion in Arkansas and decided that expansion would greatly benefit our state in every way that one could measure. Studies by the independent RAND Corporation, as well as our state Medicaid director, Andy Allison, who is a PhD economist, indicated that the expansion would create over 6,000 jobs in our state, save over 1,000 lives a year, increase state and local government revenues, and relieve to a significant degree the burden of uncompensated care for our community hospitals. All at no increased cost to Arkansans compared with not expanding health care. None of these facts have changed since that time. There were many obstacles to passing this expansion, as it required a 75% majority in both houses of our legislature, and there was significant opposition to the Affordable Care Act in general. But through innovative and creative bipartisan cooperation between the House, Senate, and Governor, they put together a unique approach to expanding health care to those in most dire need in our state by combining federal funding with private insurance, and thus creating Arkansas's private option. This plan has many advantages, so much so that the Arkansas plan, as it's being called in other states, is now looked to as a model by other states as a path forward for them as well. Just recently, the Medical Association of Georgia passed a resolution asking their state legislature to move forward with expansion in a manner modeled on the success in our state, modeled on the Arkansas plan. And that's in a red state that voted 2/3 against President Obama in the recent election. So Arkansas's plan is being looked at as a model in other states for a way to combine private insurance and values of both political constituencies to expand and provide needed health care for citizens who do not currently have it. In addition, the Department of Human Service website in Arkansas is working well for signups. This combination has made Arkansas's private option a model for other states for successful passage and signups for expansion, with 50,000 Arkansans already enrolled. I applaud that innovation and indeed the political courage of our lawmakers and our governor for making this possible in our state, and encourage them to press forward to provide financial and logistical support to finish the job and make Arkansas the national leader in this crucial endeavor. I would also like to say that continuation of this process is not just important from an intellectual standpoint, but it has impact on individuals and individual people in our state that is huge. I have a patient who came to see me a month ago with no insurance. Within the next week, I diagnosed that patient with chronic leukemia, chronic hepatitis, and a tumor in the kidney. And that patient cannot wait until the day when insurance is available to him. Not only can he not afford it now, but with those pre-existing conditions, he would never be able to purchase insurance, even if he had the money for it, without the private option expansion. So again, these are real people who are impacted by this. It has significant consequences to their health, and it benefits every person in the state. I want to introduce to you now Mary Frances Perkins of Carlisle, who is one person with patients who has her story to tell about the impact this expansion would have on her life personally.
Thank you, Doctor. My name is Mary Frances Perkins. I'm from Carlisle, Arkansas. I'm 53 years old. I went to work for Walmart Incorporated. A again, covered by their wonderful health policy. Finally, I met and married a rice farmer in Carlisle who asked me to come and work on the farm in the office, taking care of books and records. I soon discovered that when I was ready to purchase my own insurance, I was totally not able to. I had a neck injury in 2002 that required surgery. Therefore, I was constantly turned down for private health insurance. I've applied to 4 different agencies in 4 years and have been turned down for health insurance. In May of 2013, I was diagnosed also with a form of Parkinson's called essential tremors, which made it totally impossible for me to get any kind of insurance. Without this private option, I would not be able to have affordable health insurance. I also would like to applaud the governor and our legislatures for taking this brave step to create the private option. And I'd like to remind everybody that there's 1 million people out there with my same story. I'm not asking for a handout. I'm simply asking to be able to purchase health